Hi, my name is Cal Evans. I'm a student nurse at Wilson State College, and today I'm going to be performing a skills video of mixing insulins, drawing insulins, administering them via a syringe and a pen. So the first thing that I'm going to do is compare my MAR with my provider orders. So I will be beginning with that. On my provider order, I have Shirley Coast, 54-year-old female with date of birth of 5/14/1964, and then on my MAR here, I have Shirley Coast, 54-year-old female with with the date of birth of 5/14/1964. So I know that I have the correct MAR with the correct provider order. And the first medication on the provider order is a NPH insulin U100. And it's an order for 15 units subcutaneously daily with supper, and that's what's on my MAR as well. Demo dose NPH insulin U100, 15 units subcutaneous at daily with supper. So I know that that's correct. My next one is a regular insulin U100 for 10 units subcutaneously BID, and here is on the MAR, regular insulin U100, 10 units sub-Q, BID. Then next is Lispro U100 insulin pen with a mild sliding scale. So I know when it comes to administering that, I'm going to have to use a sliding scale to figure out how much I'm going to be giving. So I have the sliding scale subcut 3 times a day with meals, and here on the MAR, Lispro U100 insulin pen, mild sliding scale subcut 3 times a day with meals. So I know that that's all correct. So now that I know that I have all of that checked, I can discard my provider order and take my MAR into the med room and begin with my first medication check. So I'm going to walk into the med room, I'm going to do hand hygiene, and I'm going to find my patient's medication bin. And right here we have Shirley Coast, 54-year-old female with the date of birth of 5/14/1964, and that matches my MAR for Shirley Coast, 54-year-old female, 5/14/1964. So I can begin with doing my first check since I know that this is the bin. And so the first medication is that NPH insulin. So here it is, NPH insulin, and then there is a tag with her name and information on it and her barcode. So Shirley Coast, 54-year-old female, 5/14/1964. So I know that that's hers. And then next we have that regular insulin, U100 10 units subcut. So here's that regular 100 units per mil, 10 mils, and then it is Shirley Coast, 54 female, 5/14/1964. And then lastly is that Lispro U100 insulin pen. So it must be what this is. So Lispro U100 insulin pen, and then okay. So that's all hers. And so that would round out my first med check, and so then I can go on to my second one and get out this tray because I'm going to be taking it into the patient's room with me. Get these out. And because I'm going to be giving injections, I'm going to take in a few alcohol pads as well. So now that I'm going to be drawn up, I'm going to put gloves on. And a CNA came in and told me earlier that the Shirley's blood sugar was at 178, and that was at 1710. And so with these 1730 meds, I know that I will be giving, according to my sliding scale, 150 to 200 milligrams is is 2 units, so I'm going to be giving 2 units because 178 is within 150 to 200. So I'm going to start with the NPH and the regular mix. So again, I'm going to check. We got the insulin U100, NPH insulin U100, NPH U100, insulin, and Shirley Close 54 female. Okay, so that one's right. And then I can wipe it down for about 10 to 15 seconds. Okay, so there's that one. Also go on to wiping down the other one, which is the regular insulin U100. So I'm just going to check it again. Regular insulin U100 for Shirley Coast for female with the date of birth 5/14/1964, and that all matches. So we'll wipe this one down too. Okay. So those are sterile and ready to go, and as long as I don't turn my back on them, they'll be fine. So then I know that I'm going to be drawing them up into the same needle, and so I forgot to mix them, so I'm gonna have to mix them. Because I forgot to mix them, I would have to sterilize them with an alcohol prep. I don't know if I have enough alcohol pads in here with me, so just know in a clinical setting I would do that. I would wipe them down after mixing them. Okay, so those are mixed, and again, like I said, I would re-wipe them down. And so next I can start by getting my needle, if I can find which end. And so the NPH insulin is asking for 15 units, and so I'm going to pressurize that one first with the 15 units, but then I'm going to draw up the regular insulin first and then go in and get the NPH insulin. Pull back. So for the NPH it says 15 units. So I'm going to pull this back to 15. So that's at 15. I'll pull that off and set it there. Okay, and then I'm just going to pressurize it. Pull it out, and then I'm going to pressurize this to 10 units for the regular insulin. So we're at 10. I'm going to go in. So now I can invert it and pull it to 10 units. So right there, we're at 10. Okay. Excuse me. And then we can go in and grab the last 15 units of the NPH. And so then that'll bring us all the way to 25 with that 15. So there's an even 25. Okay. And then I'll do the scoop technique. Okay. And so that's ready, but then I'll have to write a label for it. So the first insulin in it is the NPH U100, and there is 15 units of it. And then the second one is the R insulin U100, and that is 10 units. And my initials, and then the date and time, which is 17. Okay, so that one's ready. And discard that. And so since I'm done with these, I can put them away back into the bin, and I can go on to drawing up the insulin pen. So again, with the insulin pen, the client's blood sugar was 178, and with the sliding scale I'm given, it's 150 to 200 is 200 units, so that falls in between, so I'm going to be giving 2 units. So again, I'll just check to verify this is the right one, so it's that practice insulin Lispro U100, and that matches my MAR. So I know that this is the right one. So I'm going to take the lid off, and I'm going to wipe down this part. About 10 to 15 seconds. Okay, so that's done. And then here's the needle for it. And so since that is sterilized, I can just put this right on and then screw it on. Okay. Take that out. And so then I will have to prime it to 2. So it's gonna go 1 click, 2 click. So we're at 2. And then we're just gonna push to make sure something comes out. Okay. And so then, that wasn't all of it, that was just the one. So there's all 2 of it. So then we're gonna go 1, 2. We're at 2. I'll turn it around for you. We can scoop that just to make sure we have an safety on it. Okay. And so with that, we're ready. I could write a label for that. It wouldn't necessarily be a necessity because usually with pens they're for certain patients, so their information should already be on there. So I'll still write one out real quick. So it's just the Lispro U100 for 2 units, and then just sign and date. And then when I put it on, I'll just make sure that I'm not covering any of the patient's information for the medications information. So with that, my second med check is done, and I can then deglove and then go into the patient's room with my medications and my MAR, and again perform hand hygiene. So I'm just gonna do some quick hand hygiene before I leave. I'm gonna grab my MAR and my meds, and then head into the patient's room. Hey there, Shirley, how you doing? I got your insulin here for you, just to make sure. Does that dinner that they brought in look appetizing to you? Yeah? Okay, perfect. So yeah, I got your NPH insulin and your regular insulin. And do you usually mix those at home? You do? Okay. So I got that all in one syringe for you too. So I just want to make sure. Could you give me your name and date of birth? Shirley Coase, 54, female, 5. Okay, perfect. And then I'm just going to make sure to verify on your wristband too. So it says Shirley Coase, 54, female, with the date of birth 5/14/64, and that matches my mark. And are you allergic to anything? Codeine? Okay. And that's what it says on your wristband, so that matches my MAR as well. All right. Okay, so back to that medication we're given. So yeah, we got that, your 2 insulins together, your NPH and your regular. And those onset times are for 30 to 90 minutes. And then we also have that Lispro for your fat rapid acting. So I'd have to make sure that the patient has food in front of them and it is appetizing to eat before I administer that. And again, she said that her dinner was looking good, so I know that I can give it. And then the time on that, the onset for that is 5 to 15 minutes. So where do you usually take your shots at, Shirley? In your abdomen? Okay, perfect. So we'll do that there, but we'll just make sure to move sites just to make sure that it doesn't get any tissue breakdown, okay? Okay, so we're gonna pull that back and expose the abdomen, and we're gonna clean the first site. Starting in the middle and then going out in the circular motion. Okay. And then I'm gonna grab my first medication, which is that mix of the NPH and R, excuse me, and then we're just gonna pop that off, maybe. And we're gonna pinch, and this is gonna be on this side, and then we're just gonna go straight in. Ready, Shirley? 1, 2, 3. And then we're just gonna slowly go in, making sure not to pump too fast, because it can burn the patient. So we're just gonna make sure we're going at a nice, slow, even pace. Okay, so that's done, and we can pull it out. We won't rub it, and then I will use the safety on an inanimate object. And so that's clicked and ready. So I'll grab the top and take it over to the sharps. Okay, and then for the next one, we're gonna move sites, and we're gonna re-wipe down because it is a new site. So basically we're just gonna move it over here. So this is a new site. We're gonna go like this, go from inside to outside. Okay, please don't fall. So that one's ready. And then we're just gonna uncap this. And again, I'm gonna verify I still got 2 because these can change. And this is the Lispro, and it's on my MAR at U100 for 2 units. Okay, so then we're gonna pinch, and we're gonna push down on it. Ready? Ready, Shirley? 1, 2, 3. And then we're gonna go, and then we're gonna hold it there for 10 seconds. Because these can sometimes squirt back out if not held. Okay, so there's 10 seconds, and I can pull back and release. And then I can, and so since I use that, the safety is engaged, so then I can just screw off. And throw these away. Okay, and then I would stay with my patient to make sure that she finishes her meal. I would make sure that she doesn't need anything else from me. I would cover her back up. She'd eat. I'd make sure she didn't need anything. She's sitting in a comfortable position. And then I would grab my supplies, make sure the room's neat and tidy, and I would go back to the nurse station and document and chart.